Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Cytometry Cyclone. This audio podcast as part of a Rakas and Bombard episode, and this audio podcast is part of a Storm Robotics production. Today, looking at debunking challenges and mentoring healthcare service users, and mentoring healthcare healthcare service providers and or healthcare professionals. So a patient's journey with conditions, with long-standing conditions, for example, can span many decades. CK Conditions such as long-standing conditions, such as kidney disease, for example, or the varying forms of kidney disease, at their very bases are generally multidisciplinary at varying stages, wherein there tends to be involvement from both frontline healthcare professionals and allied health professionals, or AHPs, depending upon the scenarios. Furthermore, investigations have identified that challenges and disparities where race and ethnicity are. Furthermore, sorry, investigations have informed or identified that challenges still challenges and disparities sort of exist or coexist where race and ethnicity are concerned. And whilst healthcare service users are prompted in are now more prompted, and more now so than ever, sort of prompted or are prompted to be part of, sort of more in part of sort of practices, albeit whether frontline practices, or sort of back row healthcare practices. For example, there is where healthcare service provider healthcare service users and providers are encouraged to see more joined up healthcare practices, but also a sort of a shift towards where there is a sense of taking ownership. And joined up practices should prompt positive implications for the healthcare workforce, in context of also in context of and within the National Institute of Healthcare Research, NIHR, remit, in regard to patient and public involvement, or PPI initiatives. Although research has provided valuable insights into the ways patients use healthcare services, it is also important to appreciate the sort of insight into the type of stresses experienced by both healthcare service users and healthcare professionals. And owing to the advances in around more more patients with long-standing conditions, for example, now have access, for example, to electronic patient records and literature, literature informs that healthcare professionals and healthcare professionals and patients have also have variations in computer or in around computer or and in around, sorry, computer information communication technology, sort of information communication technology and health literacy, and in context of health literacy and or technical skills, and sort of differences in attitudes toward towards communicating in context of healthcare services. Typically, patients or healthcare service users can still have challenges regarding implications in sort of in aspects of debunking some of the challenges in around sort of for example, in around the laboratory investigations that are part of or form part of long-standing conditions in regard to their sort of aspects of their interpretation and in context of their viability in and when they are requested by frontline healthcare professionals, for example. So that draws this audio podcast to a close. This audio podcast as part of the Cytometry Cyclone, this audio podcast as part of a Rakas and Bombard episode, and this audio podcast as part of a Storm Logistics production.